And this is what you call free healthcare in Canada, because I didn't even get a blood test and I was told not to worry about anything. Not to worry about the lumps.
You know, there's a lot of misunderstandings about our Canadian healthcare system here in this country. Now, a lot of people might think it's completely free, and to some extent it is free, but it's also not federal. The provincial governments and the provinces actually have their own healthcare systems, and if you're from the States, this might be kind of surprising to you because it's not all about the federal government. And some provinces are better than others. We're going to discuss it in today's video and react to a bunch of videos relating to the topic of Canadian healthcare. How bad is it right now in 2025? With that being said, let's dive in the very first video, which is crazy because one problem per visit. My God, this person's already been waiting for over an hour, and then you basically look at a sign that says you have only one problem per visit. So if you have like more than a cough, maybe you have a cough and a sneeze. Sorry, we're just going to take a look at that cough, sir. The sneeze, you're going to have to come back another day and figure out why you're sneezing. But the cough, we'll get the stethoscope. Okay, yeah, no, you're fine. Just go home. And because there is things like this that happen a lot, some things go obviously unchecked and missed at doctor's offices, you know, like cancer screenings and stuff like that, stuff that needs, you know, immediate attention. So if you're not on it, and if you're not like, you know, doing your own research to a certain extent, obviously not doing too much research, you don't want to freak yourself out on the internet there. My God, whew. Some of the stuff that I've researched when I'm sick, I just get like almost like a panic attack when I see what the results might be. Usually that's not the best route, but obviously it's nice to be like informed and know whether or not it's even worth going to the doctor, especially when you go into a walk-in clinic if you don't have a family doctor. And a lot of people don't have a family doctor in Canada, and you see something like that, you know, so be prepared to see that, especially in provinces that are really already overcrowded, like the health system is already overcrowded in places like BC and especially Ontario.
Explain this once and for all. Healthcare is not a national program. Healthcare is not federal. Healthcare is provincial. Provincial benefits only cover you in that province. You may get away with a short-term medical intervention if it was absolutely necessary. Your healthcare may provide coverage, but it doesn't have to. And the other part of that, just so you're clear, it's not federal. It's not national. Canada does not have free healthcare. Healthcare in Canada is not free. One, we pay for it through taxes and other monetary mechanisms, but there's a value associated with each transactional medical intervention you require. Now, some things are covered through insurance, through your employment or subsidiary private purchased package that covers you across the nation, but that is medical insurance. We do not have a medical healthcare in Canada that is free. You must be a resident for 3 months prior to applying for provincial coverage. And even then, if you do not qualify and meet the stipulations, you cannot get health insurance that is provided to you provincially. Okay? Let's stop having this argument. It's a Mandela effect. Everyone's just like, healthcare is free in Canada. Well, for one, things that are free are cheap or not very valuable. People don't come to Canada for their wonderful healthcare. But it's not free. Healthcare in Canada is not free.
That's actually a really good point. It's obviously something you have to really consider or just even think about, because a lot of people they take for granted the fact that we actually do pay for our healthcare, right? In terms of taxes, you know, income taxes, sales taxes, every sort of tax that you have to pay as a Canadian citizen goes into programs like healthcare provincially, right? So the federal government doesn't actually pay for your healthcare, it's the provincial government. That's why if you're in places like Ontario, there's a thing called OHIP, which is Ontario Health, right? OHIP. So that's something to think about as well. But you know what else is something to think about? This. 6 hours in the emergency. 6 hours in the emergency. That doesn't surprise me, sadly, and I'm assuming this person is probably in Ontario, because Ontario has by far the worst wait times for, you know, walk-in clinics and emergencies. It's just so bad. When I was a kid even, and this is before it was really bad, I remember breaking my finger. It literally looked like a Z. It was like jagged like a Z. And I'm sitting, I broke it in 2 places. Obviously as a kid, I'm crying, I'm in pain. And I had to wait over 3.5 hours just to see a doctor. And then after that doctor, they obviously take this scan and they see where it's broken. And then I had to wait again for another few hours before someone could actually set it back into place. And at that point, like, it feels like some of the bones are already starting to slightly fuse a bit, and they put a needle in my finger and just kind of snapped it back into place. It was a very horrible experience, but that was just something I was experiencing even as a kid, right? So if I had this experience as a kid, and this was like 27, 28 years ago, think of how bad it is now with the influx in population. And obviously a lot of people who come here, if they are coming here for free healthcare, they're going to go to the places where they think it's going to be the best, like BC and Ontario. And because the population sizes there are so big, especially in Ontario, you're going to even have longer wait times now.
So I'm at the hospital right now, and I'm just recording this to bring you guys on the journey with me, I guess. But now I'm just waiting, and I think I'm going to be getting my blood taken. I told them everything that's wrong, so now we're just waiting. And this is what you call free healthcare in Canada, because I didn't even get a blood test, and I was told not to worry about anything. Not to worry about the lumps, not to... Anyways, I just got told to go home, and nothing's worrying them. I didn't even get a blood test, so my friend's gonna book me for, because she works at a hospital, she's gonna book me for a blood test tomorrow morning. And we're gonna figure this shit out on my own, because I am not relying on my family doctor, and I'm not relying on the fucking healthcare system in Hamilton anymore, or in Canada, sorry, should I say. Anyways, I'm only filming this because this is my life right now, and I don't know what to do. It's just crazy to me that I couldn't even get a blood test, and I waited 2 hours at the hospital.
He waited 2 hours for a blood test, and instead of giving them a blood test or saying to come again another day, they're like, yeah, you're probably fine, go home. This is something that happens disturbingly a lot in Canada. If they think you're just, faking it, not necessarily faking it, if you're like a hypochondriac or something like that, good luck. You're going to have a horrible time here. So something to definitely consider if you are planning on moving to Canada, and obviously we'll have to experience the same things.
Free Canadian healthcare is waiting 3+ months for 3 urgent referrals for OT and PT. Finally getting the call last week that we'll get our initial assessment, but not until September 12th. It's the end of August. And our assessment will be over the phone. But if I pay for it, I can get in as early as today, which I can't swing, but I have scheduled for Thursday. $155 for initial assessment, but they'll see him in person. Canadian healthcare.
Yep, Canadian healthcare. A lot of waiting around for that free healthcare, and then in some cases they'll just tell you to go home because you're probably faking it, right? Leave your thoughts down below about today's video subject, and I'll see you guys in the next video. And also, leave your thoughts, if you're Canadian, about your worst experiences as a Canadian experiencing the healthcare system here. All right, I'll see you in the next video. Take care.